I think pretty much every patient I see, regardless of the disease, one of their major fears is, will my cognition be affected by the disease? And unfortunately, of course, in our space of neurodegeneration, that is often the case. It's not completely the case for everybody, but we certainly see impacts. And the idea of people, if you like, developing cognitive impairment, developing dementia, is pretty much where I started in research back in Cambridge. And my work there was really looking to see were there patterns of problems in the brain that, if you like, corresponded with the deficits that we saw when we were doing cognitive testing. And back in that space, what I did was to say, okay, well, let's see if we can see what the pattern of deficits is, and then target some new tests that we can actually explore where those correspond to in the brain. And this work came up with a new way of, if you like, challenging working memory in Parkinson's disease. And what we're able to do was to put patients into an MRI scanner and have them actually use that working memory while they were in the scanner, having pictures taken of their brain. And what it showed was some very abnormal patterns in the brain that corresponded with what the hypotheses were that I was having at the time as to what might be falling down. So that's great, and you get to understand a bit about the disease. But what we really wanted to do was to take it forward and say, well, okay, how can we improve those things in cognitive problems in Parkinson's and in mild cognitive impairment and Lewy body dementia, all of these other conditions. And so some of the work that I've been associated with in my time in Australia has been the development of cognitive training programs. And in fact, we were the first research team in the world to show that an intensive training, a cognitive training package with education, could actually improve memory in patients with Parkinson's disease. What we're hoping to do next is to develop strategies, home-based techniques that will allow patients not to have to come in to have training at a center a couple of times a week, but we'll give them more freedom so they can work on their own memory at home. So this should be hopefully far more convenient. In the clinical trial space, we are starting to see some trials coming through with some very novel approaches that might target poor memory across the degenerative diseases of the brain. And I'm excited that my team have been selected as a site for at least one of those trials at the moment, and hopefully we'll take on more, because it's quite obvious that losing those cognitive abilities is one of the drivers for people ending up in a nursing home or with a poor quality of life living at home. I am, as always, incredibly grateful to the patients who come through the research clinic and give their time so that we can learn more about these phenomena and hopefully develop better treatments so that we can relieve the suffering. So thank you.